Hi everyone. So I promised you a video on PCOS a few weeks ago before I started traveling and then got COVID and a million other things happened. So here is my video on PCOS. I thought I'd hop on and talk about that. So first I'd like to ask the question and respond to the question I often get, which is, how do I know if I have PCOS? Okay, so there are a number of different signs that kind of lead a doctor to think that you might have PCOS. If you have a lot of acne, if you have a lot of facial hair growth, if you have a hormone panel that is showing high levels of testosterone and androgenic hormone profile, that might lead a doctor to think you might have PCOS. Also, insulin resistance could signal a possible, situation where you have PCOS. Insulin resistance, you would find that out by doing blood work. Um, and then there are also sometimes with people who have insulin resistance, they have kind of these dark marks on, like, dark pigmented skin in their neck, for example, or other areas of the body. That can be another sign. And then the classic other sign is when you go in for a follicular, an antral, like a sonogram that where they count the antral follicles. Then there are a lot of them. There's more than the standard normal follicle count. And then finally, if you do not ovulate is another sign. So if you have any of these signs, then you want to go in and talk to an OBGYN and get that, or reproductive endocrinologist and get a formal diagnosis, because you don't want to subject yourself to treatment you don't need, and if you don't have PCOS. And the other thing to note is that taking the birth control pill does not solve the problem. It can mask the problem, can kind of control your hormones a little bit more, but it doesn't solve the problem. So in the next video, I'm going to jump in and talk about what are the kinds of things that you can do if you do have PCOS. And one of the things I really want to mention that must be done is to change up your beauty and bath products and make sure that they don't have obesogens in them. Because in general, in your beauty and bath products, as well as all around you, there's a class of chemicals called obesogens that will make you insulin resistant or tip you towards the insulin resistance kind of side of the spectrum. And if you have PCOS, this is really bad. But even if you don't have PCOS, it's really bad for your sperm quality and your egg quality, which means it's bad for your embryo quality. So that's another thing I'll be talking about in the next video.